Our water changed, says Flint resident Kwame Johnson, now 12. Sometimes it looked brown, adds his mom, Ariana Hawk. It smelled like rotten eggs. But since state officials insisted the water was fine, we just assumed that it had to be safe to drink, she says. Kwame's little brother, Sincere, then just a baby, developed itchy, painful rashes that mystified the doctors. His mother rubbed adult strength prescription ointment on Sincere's tiny body, but the rashes didn't go away. It wasn't until a year later, when a doctor suggested the family stop using tap water, that Sincere's rashes started to clear up. Other community members were having similar health struggles. Flint residents crowded into city meetings armed with plastic bottles filled with their discolored tap water and demanded answers. Some people organized a grassroots effort to have residents collect samples of their tap water for testing. Finally, a local health center discovered that the number of kids in Flint with elevated lead levels in their blood had nearly doubled between 2013 and 2015. A doctor announced the findings at a news conference in September 2015. Within days, state officials finally admitted the truth. Flint's drinking water was toxic. Safe water needed. The state switched Flint's water source back to Lake Huron shortly afterward, but the city's pipes had already been damaged. Unless they were replaced, lead would continue to leach into the water. In January 2016, the state began delivering free bottled water to residents to use in place of tap water. A few months later, workers started replacing the city's pipes. Flint residents are still being warned not to drink unfiltered tap water. Michigan and the U.S. government have committed $150 million to pay for the work and other water-related improvement projects in Flint. As the issue went to press, workers had swapped out about 8,700 corroded pipes, with about 7,000 more to go, city officials said. Flint's mayor has vowed to finish the project this fall, but there are no guarantees. The process is slow, in part because workers have to determine which pipes are corroded before they can replace them. State officials say the new pipes have already made a difference. In spring of 2018, tests showed that most of Flint's water now falls below the federal limit for lead. After those results were released, the state stopped providing free bottled water. Yet, the Environmental Protection Agency, the EPA, continues to warn Flint residents not to drink, cook with, or even brush their teeth with unfiltered tap water until all of the corroded pipes are removed. Still desperate for safe water after all these years, many residents wait in line for hours when bottled water donated by businesses or nonprofits becomes available each week. Others buy their own. Kwame's family alone goes through about 240 bottles of water a week. We've been lied to so many times by people we trusted, says Hawk. How can we trust their word when they tell us the water is okay to use? Fears for Flint's kids. Perhaps the scariest part is what's unknown, how the water crisis will affect residents' health over time. Research has linked lead exposure in children with mental and developmental delays, emotional disorders, learning impairments, and shortened attention spans. In Flint, many parents have reported that their kids aren't growing properly or they are acting out in school. Kwame sometimes has trouble remembering and focusing, and Sincere still suffers from bad rashes. Last year, the state of Michigan agreed to spend $4 million to test Flint kids who were exposed to lead. The results will help determine which children need extra health care and special education services. A federal lawsuit is pressuring the state to provide those resources for free to any affected kids who need them. A city moves forward. Many Flint residents struggle with feelings of betrayal because their water was contaminated in the first place and because they still can't trust their water. Adding to their frustration, criminal charges against local and state officials who allegedly covered up the problem for months were recently dismissed. Experts say demographics, Flint's residents are largely poor and more than half are African American, put the city at higher risk of a water crisis. Places with high populations of poor people and people of color are most likely to experience environmental disasters, says Paul Mohai of the University of Michigan, an expert in environmental justice. The responses to these disasters tend to be slower in such places as well. When Flint residents raised concerns about the water's health impact, the state's initial reaction was to discount the complaints. Mohai says that is how poor and mostly minority communities have been treated in these situations. Still, he notes the attention that Flint has received has helped shed light on the issue. That could help policy experts avoid situations like this in the future. Many people want to do the right thing, he says. In that way, I see progress. In the meantime, Kwame's family and other Flint residents haven't given up hope or on Flint. His mom remains committed to supporting the community and regularly delivers cases of water to older residents in town. 1 or 2 cases of water isn't a lot, she says, but the least I can do is try to help.